Hello, and thank you for joining us on our LinkedIn Live. Today, we're going to be talking about anonymity, avatars, and anime, why Japan's HCP influencers are like no others. Today, I'm joined by Abhinav, our head of pharma, Mariko, our senior insights analyst, and Yukari, our insights analyst, and myself, CEO and co-founder of Convosphere. We at Convosphere are a social-first digital insights agency specializing in the use of global online data to answer a wide range of strategic business questions. Through human-led social listening and data analysis across more than 100 languages, we deliver deep cultural insights that bring our global clients closer to local audiences. We work with agencies, enterprises, and brands to help our clients make better informed strategic decisions with measurable impact. Today, we'll be talking through some of the opportunities and insights from the Japan market, and I hope you enjoy the session. If you do have any questions, please pop them into the chat or feel free to comment, and we will try and address all of your questions towards the end. But let's get started. I think before we even get into, what's specifically going on in the Japanese market, I think we need to set the stage with what are KOIs. So KOIs, key online influencers, and how do those key online influencers compare to regular influencers or key opinion leaders, and why all of these different types of individuals or profiles might be important to pharma. Abhinav, I know that this is something you've worked quite a bit on, and we could easily dedicate a whole LinkedIn Live session to this, but if you were to summarize, what are KOIs and why should they matter to pharma and healthcare companies?
Yeah, thanks for the introduction, Jackie. Yeah, so as you correctly said, it definitely is a big topic, and it can definitely we can dedicate a whole session around this. But for now, just to summarize it very briefly, key online influencers are similar to KOLs or key opinion leaders, but they are like HCPs who have authority in the field of the study. But at the same time, they have an online presence, significant follower base, as well as activity and focus around the condition on like major social media sites and channels. So as we know that generally pharma companies have a list of KOLs that they engage with, or they kind of they have a predefined list of KOLs with them. But like when we worked with different kind of projects on this list of KOLs, we have seen that typically only 10 to 15% of the KOLs have an active digital presence, right? So not all KOLs are KOIs. Only a very small portion of them are KOIs. And as well as we see that when we do our analysis, we find new KOIs or key online influencers who are active in the space, who have a very good influence, and who are very focused around the disease area, as well as they have authority in the field or offline presence, right? So this is why it is important for pharma to conduct such studies and better understand who are the KOIs and how to engage with them effectively. So yeah, this is basically the need that uh, this kind of study or is important from a pharma's perspective.
Okay, and we're referring to them as KOIs here. I know that that might differ across different organizations. Can you share some of the other names people might be familiar with?
Yeah, definitely. So it's necessarily the same thing, but in certain cases, we have heard like organizations using DOLs, opinion leaders, then key influencers, key digital influencers. So all those kind of terminologies are used, but it's basically influencers or HCPs who are authoritative in the field, but at the same time qualify as a digital influencer due to their presence, activity, and followership. So yeah, it can be named any which way, but if for here we are referring it as KOI, but yeah, it's the same thing.
Okay, thanks. And why Japan, I think, would be the next question. So I know that Japan is an important market to many pharma companies. Why are so many businesses in the pharma and healthcare industry interested in Japan, in addition or different than they are to other markets? Abhinav,
Mm.
I know that you've worked across many different markets in your years of doing social intelligence.
Mm.
Can you give us your view on this?
Yeah, definitely. So yeah, so lately, Japan, we have seen a lot of requests coming from social media studies focused particularly in Japan. So it has gained a lot of importance. But apart from that, I would like to say from both perspectives. So in general, from a clinical and disease prevalence and a commercial side, also I think Japan is pretty important for pharma companies. So that is something that is there. But from the social media side, the importance or the focus has been increasing over time. The reason being primarily that the Japanese stakeholders and audiences are very different from even regional behavior. They express very different kind of behavior even when we compare to the region or at a global level. So it is very important to conduct specific studies around Japan, both from the client and the stakeholder perspective, or patient and caregiver perspective, as well as HCP perspective. So that's the reason why we can see an increasing focus on Japan as well as conducting studies based on Japan. And this is why we are hosting this session. I think so because this is a classic example of why Japan is different and how it is important for pharma companies. The scenario of influencers and anonymous influencers. So yeah.
Thank you. So, when we're saying anonymous influencers, what does being anonymous online actually mean? Because traditionally, when we're talking about influencers, we think of online influencers or people that you would recognize by their face or name or their profile, and that's why it can be hard to understand how this works when these people are known for who they are. But in this case, we're talking about anonymous key online influencers. Mariko, could you possibly describe what this culture of anonymous influencers looks like? And what exactly does anonymity mean in the context of KOIs or online communities in Japan? Do they completely hide their identity?
Yeah, so when you think about the KOIs, especially in those like a medical space, you would imagine doctors with real names, with real photos, maybe wearing scrubs or wearing suit, wearing glasses, looking very serious, crossing their arms, like which definitely gives you an impression or even an assurance that they are very professional, they are authority of the field, and that they are very credible. And yeah, of course, we have such accounts in Japan. But today, I really would like to show you some very interesting example of popular KOI in Japan. Yeah. So can you move on? Yeah. So I think the difference is pretty noticeable. So who are they? So they are pathologist, allergist, surgeon, ER doctor, and yeah, they have very pretty impressive number of followers. And as you can see, their icons are cartoons or illustrations, not really they're revealing their real face. If you look at their bio, they actually adding a little bit more information about who they are. So they often mention their specialty, sometimes medical schools they attended, their affiliation. They don't necessarily say that which clinic or hospitals they're working, but sometimes they mention their affiliation with a certain professional organization of the specialties, or even like the publications or the home pages, other accounts that they own in other platforms. But obviously, they're not really putting their real name up front. So their account names actually really sound like cartoon characters or like anime characters. So the Dr. Yandel, it's a kind of like a homophone of the sick in Japanese, which is very clever. Dr. Homu Homu, not really, like you can tell like it's not real name. Surgeon Ku, which sounds like a real name, but it's a kind of made up name. He combined two syllables from names of his own two children. So yeah, they don't really use their real names, but they have obvious made up nicknames, and people easily notice that. But they're definitely real medical professionals. But online, they just create this different persona. By doing so, they really can appeal to wider audiences, especially regular people like us, patients and caregivers. Those nicknames or cute icons definitely gives you an impression that they look more friendlier and approachable, that ultimately people can really relate to. And I would say this is very important because in Japan, HCP and patients' relationships are not always very equal. So doctors are called sensei, like the same as teachers, which is a very respectable term, and then they're like very seen as like authoritative figures. So we often come across in our research that there are lots of issues around the HCP and patient communications, that patients and caregivers, they're intimidated by them, sometimes very scared to ask questions, worrying that they would offend them or waste their time.
Okay, that's really interesting. So you've shown us how some of the KOIs from markets outside of Japan are showing their face, they're showing their real name, and you've shown that these social profiles are anonymous and use like a pseudonym. Yukari, do you have any thoughts on what's the reason behind these influencers are deciding to hide their identities?
Yeah, so I think one of the key reasons for these hiding these identities is rooted in the concerns over privacy, driven by unique Japanese culture around, conforming and also following the social norms. And anonymity on social media is quite common on social media platforms in Japan. And stats show that on Twitter, at least around 70% of accounts are anonymous. And this is because this kind of anonymity allows Japanese people to have more freedom to voice their opinions, freely express themselves without that fear of judgment or criticism that they otherwise feel in society. So on social media, by becoming anonymous, that kind of likelihood of that affecting their real life job or persona is decreased. And it's also important to note that these KOIs are not fully anonymous per se. So like they reveal things like their profession or their specialty or their expertise, as Mariko mentioned, so that they retain that credibility necessary. However, they do not share more private information like their name or their gender or location, since it doesn't necessarily contribute to their online credibility nor support. And actually, by adopting this kind of general HCP persona through characters, they increase that relatability, which is more important to the Japanese community.
That's really interesting. Thank you. So Abhinav, you've worked across a number of different markets. Have you seen this anywhere else in any of the other markets?
So, based on my experience, I think in most markets, we can see that influencers in generally try to establish through their online presence, they try to establish authority, reach, and influence, right? And they try to grow their offline presence online, try to create a kind of their visibility. They use social media as an amplifying platform to kind of increase their reach and kind of authority within their peer group as well as patient caregivers, right? So that's the reason that in most cases, in most market, we have seen that they highlight their real name, associations, any information that can make them more credible, and their kind of information opinion that they are sharing is credibility, right, to increase their credibility. So that is predominant behavior that have seen across markets, and which is very different from Japan. I don't think this behavior I have seen in any other market. Only one thing I would like to highlight, that in some cases we see pseudo names being used by some of the doctors, like Rheum Doctor or Doctor Diabetes. But those are the cases where they want to mainly associate themselves with the disease, and kind of have a more easy association in minds of patient caregivers and their fellow colleagues. So that's why they use those names. But in that cases also, they clearly state the association, the real name, and other links to other platforms where they can easily find their information or real kind of identity. So it's not a similar kind of situation as Japan. So I think the case in Japan about anonymous in kind of HCPs and influencers and creating the anonymity and creating the personas is very different and unique.
Okay, thank you. And speaking of channels, like you mentioned, Abhinav, do we see in Japan that there's any active differences in the level of anonymity between the platforms? Are we seeing it on all platforms? Are some more open to this or prevalent? Yukari, do you have any thoughts on that?
Yeah, sure. So I think in general, social media platforms in Japan are used in this way. So it's quite anonymous. And in terms of healthcare KOIs, platforms like Instagram, forums, they have high levels of anonymity. Again, due to the nature of Japanese social media being a place to, freely express themselves and their creativity through an online persona. I think the main platform where anonymity isn't as common is Line. Line is a Japanese kind of messaging and social networking app similar to Weibo in China. It's because of the nature of the account, everything is private and encrypted, and it's used as a messaging app. In that case, a lot of healthcare clinics and doctors would have their own Line business accounts to allow patients to be updated about their news and make online appointment bookings. So in that case, it's less anonymous. And in other ways that patients use, what online websites they use to connect to doctors. There's HCP and clinic search websites like Doctor's File. That's it's a website in Japan where it showcases available HCPs by their specialty and their names, where patients can actually use that to research the best doctors in their region for their needs. And in that case, obviously, their details and their names, and it's less private. But I would say in general, it's there's a mix of anonymity and public people, but on social media, it's quite unique to Japan.
That's very cool. So, are we seeing this just in healthcare, or are anonymous influencers and KOIs existing in other categories in Japan? Any thoughts on that?
Yeah, sure. So I think, hopefully you see on the slides here some examples. But in terms of, there's in industries of all varieties, like cooking, lifestyle, fashion, music, they all have quite prevalent anonymous influencers that are becoming even more popular and more active. And as you can see on the screen here, even for areas like fashion or makeup, where they post their real life snapshots of their clothes or their homes, they don't actually reveal their faces or their names, and that increases that kind of mysteria, or they become less ordinary. So it actually works in their benefit. And especially for areas like music or entertainment, adopting a AI avatar or a character or anime, persona is becoming quite popular, and allows for more quote unquote ordinary people to rise to fame online. A lot of the top musicians recently are they're AI, and you don't know their real faces or their real names. It's kind of becoming a new emerging trend across a lot of different industries.
So they're anonymous, but they're influential. How can we even trust this advice? Because when we talk about influencers or influencer strategies, it's also often closely associated with trust. So, we have to trust that these anonymous people are giving good advice and saying who they are. And how can users, patients, or even pharmaceutical companies trust people who aren't showing their name in the face? How do these communities develop around them? How do we, how is trust built? And is there even a preference for anonymous versus anonymous influencers versus real life influencers?
Yeah, so one thing I need to bear in mind about the influencer marketing in Japan is that, especially for the pharma companies, is that there are lots of restrictions So they're not allowed to promote their products unless it's a OTC. So here the focus can go more on patient education rather than promoting your own products to the consumers. So, but more focusing on the promoting like a basic knowledge about the disease area, treatment.
I think you've frozen, Mariko. Yukari?
Yeah, sure. Yeah, as Mariko was mentioning, I think in terms of like building the trust, they still actively interact with other HCP influencers online, so that they people know that they're actually they're credible. And they also, whenever they put information online, they always make their source clear. They're also make sure whenever they attend conferences, whenever they publish research papers, they actually show that online as well. And they don't want to like broadcast their name to the wider public. But they do retain that willingness to reveal themselves when necessary and reveal that important information when necessary. So I feel like there's a balance between retaining trust, and in Japan, it's not necessarily the case that they have to reveal private information just because a lot of that's not necessarily the most important when it comes to like the credibility and the trust.
Okay. That makes sense. And so from some examples here, we see that some of those influencers are kind of engaging with or collaborating with some of the pharmaceutical companies in Japan as well.
Yeah, exactly. So like on these examples, they say that they're like what kind of work they've done before. It says what kind of like clinic they work in, what specialties they have, what kind of career they've had. Like in the books, they actually do describe their educational background or the career background. Just not the specifics.
Okay, very cool. And so, we already know that pharma is working with these anonymous influencers, but Abhinav, do you have any ideas about, how pharma or digital health agencies could learn from or work with or identify opportunities in working with anonymous KOIs?
Yeah, definitely. So I think, yeah, so already as we can see that they are kind of they are also open to offline collaborations and being part of events and kind of conferences. So this, which is already a good thing, because this is what definitely pharma can utilize them. But I personally see that the scope at the online space is far more. The reason being that they have developed this community around influence, like patient caregivers and other HCPs and peer groups, right? So they have really developed this great online communities over years, and they have a good follower base. At the same time, even patient and caregivers are pretty open with these influencers. They are kind of interacting with them on a regular basis. They are sharing their concerns and opinions about different things, and they are kind of guiding it. So I think that this community that is already there are two things which pharma can utilize it. One is obviously actively engaging or help kind of collaborating with the influencers for awareness generation and better engagement, and sharing more information around the condition which these influencers are already doing. And that is where I know that a lot of pharma and healthcare companies and agencies are actively working in this space globally, and they are trying to create their own communities to help and reach out to patients. And these influencers are definitely giving a good platform for such initiatives. As well as another area is basically kind of gives us an opportunity to pharma and agencies to basically listen through the patient conversations and caregiver conversations which are happening on these kind of communities, which is also a valuable input for pharma to understand where they need support and what kind of information is helping and what are the collaboration opportunities with these KOIs, right? So it's a very, I think it's a win-win situation for both the KOIs and pharma if this kind of like when this kind of collaboration is explored.
So I think the way that these KOIs are communicating with the audience of caregivers, patients, or even their peer HCPs, from what you've shared a bit, is quite different than the way that the pharma company